Start with doing the wrapping for the ankle because ankle is one of the most commonly affected joints in sports. Every sport that requires jumping, landing, fast running, sudden changes in direction, starts and stops, the ankle is always vulnerable. And therefore, it is really important for the athletes to prepare ankle for to be in a state of readiness for the sports by doing sufficient strength training of the lower extremities, doing a lot of proprioceptive training, neuromuscular training, functional training, doing proper warm-up before you do your get into your training and competition. Those things are more important. Wrapping is only when something has happened, you need to provide that support, right? While prevention is always more important than uh, managing an injury after it happens. So, most common mechanism of ankle injury is, we all know, it is plantar flexion and inversion, right? It is plantar flexion and inversion. So what we do is, when we wrap, we try to keep it everted or in the neutral position and slightly dorsiflex. So this is a good position when you want to apply the wrap, okay? And when it inverts, so all the three ligaments, what are the three ligaments here? ATFL, PTFL and CFL, right? These are three ligaments most commonly injured. So our objective of ankle wrapping is to stabilize the plantar flexion aspect as well as the movement on the subtalar joint, which leads to inversion and eversion. Okay, there are many ways of wrapping the ankle. I'm looking at what size. Okay, you have the wraps of different sizes. You have the 3 inches wrap, 6 inches wrap. Depending upon the athlete's body size and the body part that you are trying to wrap, you select the size and the width. Generally, when you have a place like anchor at the ankle, where you have lots of bony prominences, lots of round contours, try and select a wrap which is rather narrow. In this kind of case, selecting a wider wrap like this is not a great idea. So either you select a wrap of this width or maybe a wrap of this width. That should be good enough. But looking at her feet size, what size of shoe you have?
6, UK 6, 5.5.
UK 6, 5.5. So I think a good idea would be to use a smaller one. If it doesn't work, we will shift to a wider wrap. All right? Okay. Although we say that generally we want to free this point of fifth metatarsal, and that's a good practice to have. Okay? But this is more important when you're doing rigid taping, because this is elastic and it allows that movement. It is okay if you ride a little bit on the metatarsal, not much of a problem. But it's a good practice to do in your when you deal with the athlete, to keep this part free. All right, okay. So our objective is to keep it a little bit on the dorsiflexion side and make sure that you can see this straight line, because when the athlete gets down, he or she will step on the ground flat. So don't do it too much dorsiflect, don't do it too much plantar flexed. All right, make sure that when you see from the top, this looks by and large flat and straight, so that the discomfort of landing and discomfort of walking is minimized. All right, now remember, whenever there is an inversion sprain, we always go from
Medial to lateral.
medial to lateral. This way or this way? Underneath, because if you go this way, we are doing inversion again. So it is always medial to lateral from top down. Just remember, from top down. Okay, and we discussed that we start a little bit of oblique turn, and that is because we want to have this little nice tongue-like thing that will give us the additional grip on the subsequent rolls. Okay, all right, good. So now, as I said, there are many ways of wrapping the ankle joint. We will try and learn all the 4 ways, at least one by one. The first one is quite easy. You just keep rolling. Remember, it is good to have that spica forming. And after that, we are done with it because we don't have too much of length. Okay, now what is important is look at this pattern. This pattern is then you can come over this side rather than scare the athlete. Okay, this pattern formation is really important because it gives good amount of compression as well as good amount of adhesion on the ankle joint, on the wrap. Okay, now let's unwrap this a little bit and see what more we can do with this wrap. Using the same basic technique, from here onwards you can do a figure of 8. Go back, behind, come in front, up, again go back, and then finish it up. All right? Using the same technique or the same process of wrapping, you can do something more. And that something more is go back. For figure of 8, we went up. But for heel lock, we go down. Okay? Come up. Go back. And this way again. And come down. Now see what happens here. A nice triangular okay, Priscilla, if you can just turn a little bit. Oops. A nice triangular thing forms. This is very characteristic of heel lock. And when you lock the heel, what happens is the movement of the talus on the calcaneum, where we see the subtalar joint, where inversion and eversion happens, is actually minimized. Okay? That is the advantage. And if you still have the length left, what you can do is, following the heel lock, go up, do a figure of 8. And then finish your wrap. Even better. Okay? So that's one way of doing it. So the first one is just go all the way, spica, 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 spica. Second option, figure of 8. Third option, heel lock. Fourth option, heel lock plus figure of 8. Okay? Now there's another way of wrapping the ankle, which we sometimes see the people practicing, is from here, pull it up and make a sling like this. So when I pull it up, it forces the feet into dorsiflexion. Correct? So from pull it up, go down. Pull it up, go down. So keep moving up on this and keep moving up on the sling-like stuff that you have created. That's another way of wrapping the ankle joint. Okay? It's difficult to say which one is better. But standard thought should be, you need to compress, number one, and you need to stabilize. So compression and stabilize comes from a good combination of the usual wrap plus figure of 8 plus heel lock. Okay? So because you have 3 different things, it might be good to select a wrap which is a double wrap. You've got sufficient length here. At the same time, remember, do not bulk it up too much, because the athlete will eventually wear his socks or shoes. If this is massive, or that's going to be very discomfort, a huge amount of discomfort to the athlete. Okay? Also keep in mind that when we talk about wrapping, because it is elastic, it is meant to give compression to the body part. So when swelling is there, this is the ideal wrap or compression to give, not the rigid bandage, rigid adhesive tape. This is really important. When there is active swelling and you're expecting swelling to go up in the next 2-3 days, this is the ideal thing to do. Okay? Because this gives compression as well as support at the same time. So it will minimize the bleeding, minimize the swelling, minimize muscle spasm, pain and discomfort, as well as compression at the same time, as well as support at the same time. Okay? Easy? All right. And remember all those things that we discussed. Your body language, where you stand in front of the patient, especially if it's a patient of opposite gender, all matters. Do not try to do shoulder standing behind the patient. Be visible to the athlete. That's really important. Because when you're visible, there is eye contact. All right? All those things are really, really important. Okay. Stop.